Successful patient recruitment is a critical component of any clinical study. Unfortunately, it also happens to be one of the biggest challenges. In today's world, concerns about information privacy and skepticism mean that sites must establish trust from the first interaction, especially with growing sponsors. However, this can be time-consuming, particularly for studies with extensive inclusion and exclusion criteria. We've seen these common pitfalls in our experience. First, many sponsors focus site selection around study sites with a substantial existing patient base, expecting them to perform. Second, sponsors often expect sites to enroll on their own without collaborating with them, engaging them, or launching a recruitment campaign to generate external referrals. This leads sites to become complacent with patient recruitment and to prioritize your trial, especially if it is difficult to enroll. Lastly, not engaging with your sites leaves you vulnerable to recruitment challenges down the line, as you won't have on-the-ground information on recruitment challenges directly from the sites. After recruitment slows, we typically see that the sponsor expends extra resources and time to get the study back on track. We found that successful patient recruitment hinges on the following areas. First, launch a recruitment campaign as soon as the first site is activated. Relying solely on study site recruitment estimates is often a mistake that leads to study delays. Second, when possible, meet weekly or bi-weekly with site staff to uncover bottlenecks and tackle them with the site together. This establishes trust with sites and keeps your study on their priority list. Last, it's essential to stay in regular communication to continue uncovering issues and resolving them as the trial runs. Sponsors who meet with many of their sites regularly are, in essence, able to crowdsource information on what works and what doesn't. Once a sponsor becomes engaged with the sites, we've seen a marked shift in both the ability to recruit and the study staff's morale to accomplish study goals. Staying engaged with sites regularly offers the additional benefit of addressing non-recruitment problems, such as protocol deviations or adverse events, and helps the study remain compliant. P.S. We know that not all sponsors can set aside time to meet with all the sites regularly. At CliniBiz, we integrate with sites and sponsors to facilitate recruitment discussions and activate site motivation. Please leave your comments below, like and share this post.